Roland Consult EOG Standardized Operation Steps. This operation is performed in accordance with ISCEV 2017 version EOG standard. Patient preparation. At least 30 minutes of natural light should be done before the examination. Fundus fluorescein angiography and fundus photography should not be performed before the examination. Before EOG examination, both eyes' pupils should be synchronous dilated. The pupil should be dilated to a maximum size, at least 8 mm. Record pupil size before and after examination. The EOG recording electrode can be silver chloride electrode or gold cup electrode. EOG requires 2 recording electrodes per eye, no difference between active electrodes and reference electrodes. 2 recording electrodes in the right eye are connected to the amplifier channel 1 and placed in the outer canthus and the inner canthus of the right eye. The 2 recording electrodes in the left eye are placed in the outer canthus and the inner canthus of the left eye with the amplifier channel 2. 2 electrodes in the inner canthus of both eyes are located equidistant from each other on either side of the nose. Both eyes share a grounding electrode, which can be placed on the forehead, top, earlobe or mastoid. Before the formal examination, ask the patient not to move his or her head, but to move his or her eyes to the left or right side and fix on the fixation point light. It is necessary to practice before the examination, and it should get the stable and high-quality waveform before the formal examination. Software operation steps. Select EOG. Click dilated pupil. Enter the patient's last name, first name, date of birth, sex, select gender, and click Store Patient to save. Click Yes to save. In the condition of completely opaque dark room, the patient first adapts for 5 minutes, and then clicks Start to start the examination. Ask the patient not to move his head, his eyes follow and look at the left and right leads. The dark adaptation examination lasted for 15 minutes, in which 10 seconds were recorded in each minute and 50 seconds were taken as an interval. After the dark adaptation check for 15 minutes, it will automatically enter the light adaptation check. The stimulator background light will automatically turn on, and the light adaptation check will take 15 minutes. The interval time is the same as before. If the peak waveform has been observed during light adaptation, the inspection can be stopped. Results analysis. Click Menu Analysis for waveform analysis. The dark adaptation trough and light adaptation peak should appear after 5 minutes, especially the dark adaptation trough should be paid attention to. If the automatic identification is in the first 3 minutes, it is caused by noise. It should be moved to the lowest position after 5 minutes. Click Smooth and smooth over and over until the jagged waveform is not too obvious. Click Save Examination to save the results, and click Print Out to print the report. In this case, the left and right eye dark trough potential more than 400 microvolt, light peak potential more than 900 microvolt. Light peak time more than 7 minutes, normal range is 7 to 12 minutes. Light peak LP dark valley DT ratio more than 2, namely Arden ratio, normal range is 1.74.3. Gosh Roland, worth having.